We will now use the Spline tool to provide additional guidance to the AI for treatment planning. Think of the spline as a virtual arch wire that defines the overall shape of the dental arch. You can switch between the maxillary and mandibular arches depending on which spline you want to edit. We'll begin with the maxillary arch. You can isolate the maxillary arch using the View Maxillary button, or choose to view both arches together if you want to manipulate them simultaneously. The green control point allows you to move the entire spline using the on-screen manipulator, or by using the spline offset table on the right side of the screen for controlled incremental movements. This table displays the precise movement of the spline across different planes and also provides arrow controls for accurate adjustments. The software provides control points along the splines, blue for the maxillary arch and yellow for the mandibular arch. You can fine-tune the spline by adjusting these control points along the arch. For instance, you may choose to slightly expand the premolar region or restrict the movement of the second molars by keeping the spline close to the FA points. This ensures that the AI respects your intended tooth positions while aligning the case. You can also scale the spline using the narrow and wide options, which adjust the arch inward or outward without affecting the position near the central incisors. For more precise refinements, you can enable the grid tool to help define the symmetry of the arch form. If you want symmetrical changes across the arch, you can enable the mirror arch option. This ensures that any adjustment made on one side of the spline is replicated on the other side, maintaining overall symmetry. After completing the maxillary spline, you can coordinate the mandibular spline using the Adjust Mandibular Spline option after selecting the mandibular spline. This automatically maps the lower arch to follow the upper arch while maintaining a 2 mm clearance. Similarly, if the mandibular arch is already well aligned, you can coordinate the maxillary spline to follow it using the Adjust Maxillary Spline option. In cases such as Class 2 or Class 3 treatments, you may also enable maxillary distalization or mandibular distalization depending on your treatment plan. If the AI-generated spline does not appear suitable, you can switch to a default spline using the Load Default Spline option. This provides a standard U-shaped arch form, which can then be manually adjusted to match your case requirements. The central control point of the spline represents the dental midline of the arch. You can choose to maintain the existing midline or adjust it depending on your treatment objectives. Similarly, the mandibular midline can also be modified. You may choose to align it with the maxillary midline or intentionally maintain a discrepancy depending on the clinical requirements of the case. If at any stage you want to revert to the original spline given by the AI, use the Reset tab. Once you are done setting the spline, click Next. The AI will then use all the inputs provided, including the FA and occlusal points, tooth axis, occlusal plane, and the spline to compute the final treatment outcome.